Thank you, Mr Deputy Speaker. The Wales constituency faces some real challenges in healthcare. We have an ageing population and demand for the local NHS is growing rapidly. There is no doubt that our primary healthcare system is under considerable strain, so is the adult social care system, and our hospitals face record demand too. But calling this a crisis is a disservice to those in the clinical commissioning group and our local hospital trusts, who have worked so hard to prepare for the incredible challenges they're facing this winter. Demand in the 4 A&Es that serve my constituency was significantly higher in the week between Christmas and New Year than in the same week the previous year. In 2 A&Es, demand had almost doubled. I know that the A&E staff had to work extraordinarily hard to meet that demand, and I know too from some constituents who have contacted me that some people had not been seen within the time that they might expect. However, I have heard from others who arrived at A&E expecting bedlam, only to be seen in well under 4 hours. Indeed, during last year's Christmas recess, I spent the early hours of Christmas Eve in Western Hospital A&E with my then 3-year-old. Like this year, the Labour front bench were claiming crisis, and yet I saw some incredible clinicians doing an incredible job well within the required timelines. Moreover, an outpatient appointment needed in the week between Christmas and New Year was easily arranged and kept. My personal experience is just one of the millions of experiences within our NHS each year, but I highlight it because if we are to have an honest, factual debate about our health system, we should caution against the emotion of individual experiences, for there will always be at least one that illustrates whatever point you are seeking to make. Further into the hospital system, 3 of the 4 hospitals that serve the Wales constituency have more beds available this year, in the last week of 2016, the first week of 2017, than they did in the corresponding period the previous year. And whilst occupancy last week in Taunton and Yeovil was 81% and 82% respectively, it is true that occupancy in Bath was 93%, and in Weston-super-Mare last week it was 100%. Make no mistake, occupancy levels such as those are a cause for real concern. But it is also important to note that whilst things are tight, so far the trusts are managing. However, I know that for all 4 of those hospitals, and particularly Western, there are far too many beds blocked by those who would be discharged if care at home could be arranged. The government has made more money available for adult social care and has given councils greater flexibility to increase council tax in the interim. But Somerset County Council and our local NHS organisations are justifiably still very concerned. So I encourage that the government looks again at the local government funding settlement for next year and adjusts it to ensure that, firstly, the funding gap between urban and rural areas does not widen, and secondly, funding for adult social care clearly and fully reflects the places in the country where the demographic is most top-heavy and where rurality increases the costs of delivering that support. Finally, Mr Deputy Speaker, is the challenge we face locally in primary healthcare. Local practices have assured me that anyone requiring an emergency appointment is seen that day. However, it is true that my constituents are too often expected to wait for a week or more if they require to see their regular GP. Quite understandably, for those with long-standing and complex health issues, they expect to see the doctor they know, so these waits are unacceptable. But it is wrong to connect these waits solely with funding. For the greater challenge in Somerset is not the primary healthcare budget, which has risen for each of the last 3 years, but our ability to recruit new GPs. The Secretary of State has worked hard to deliver more GPs into the system as a whole, but now rural CCGs like Somerset's will need to look at what initiatives could be developed to encourage new GPs to ply their trade in rural general practice. Furthermore, we must listen to and support those responsible for our STPs. We have called again and again for politicians to keep our noses out of NHS planning. Now that we have, and local clinicians are now at the helm, the opposition dismissed their work as well because it is politically expedient to do so. The STP in Somerset has been written by people who really know their craft. And when I asked them whether they would have written the plan as it is, even if there were no resource constraints, they told me that they would. They say that the demand has changed. They tell me that the thinking over public health has changed. And they tell me that the clinical view of how and where people should recover after they've been in hospital has changed too. And things will change further yet over the years ahead. Some of the things the STP proposes are very challenging to me, Mr. Deputy Speaker. Some of them will be very unpopular with the community I serve. But their analysis is based on an expertise that far outstrips mine, and so unless I am being implored to now reassert the supremacy of politicians in these matters, we have, after all, apparently had enough of experts, I think we owe it to the clinicians empowered to now design and run our local healthcare systems to scrutinise, of course, but also to support them. Moreover, they deserve to do that without the partisan hullabaloo being stirred up by those opposite today.
Hear, hear.
Our inboxes give us a great feel for how things are, Mr. Deputy Speaker. Our conversations with constituents, clinicians and patient participation groups like the one in Cheddar that I will see tomorrow night shapes that view too. To claim that all is perfect right now is not true, but to claim a crisis is not true either. Our population and the practice of medicine are changing. This debate needs to happen, but not in a partisan furore, but in an honest, constructive and supportive way instead.